Good afternoon, everyone. This is Shay Kimbrough, Business Development Coordinator for the Refuge a Healing Place. We are so honored that you all have taken the time out of your afternoon to join us for this wonderful webinar. I want to tell you a little bit about our presenter this afternoon. Dr. Stephanie Carnes became the president of ITAP in November 2010. She's a licensed marriage and family therapist and an AAMFT-approved supervisor. She speaks regularly at national conferences. Her area of expertise is working with patients and families struggling with multiple addictions, such as sexual addiction, eating disorders, and chemical dependency. Dr. Carnes is also a certified sex addiction therapist and supervisor, specializing in therapy for couples and families struggling with sexual addiction. In the past, Dr. Carnes has served as the director of several residential addiction treatment programs and has also served as a faculty member at numerous universities, including the University of San Diego. She's the author of numerous research articles and publications, including her books, Mending a Shattered Heart, A Guide for Partners of Sex Addicts, and Facing Addiction, Starting Recovery from Alcohol and Drugs. The Refuge is very honored to have Dr. Carnes here with us today. As usual, if you would like, please type your questions in the chat function and we'll make sure she gets to them. And without further ado, Dr. Carnes.
Thank you, Shay. Well, good afternoon, everybody. I'm delighted to be here. This is my first webinar, so I am hoping, I usually love to keep my presentations interactive, so I'm hoping that you will send questions into Shay for me to answer as we go along. One thing I would add to my bio is I have also a second book for partners of sex addicts that Shay didn't mention that's a little bit more recent called Facing Heartbreak, and it's Steps to Recovery for Partners of Sex Addicts. So Shay mentioned my professional background, but my personal background, I'm an adult child of a sex addict and also an ex-partner of a sex addict and had gone through my own disclosure process about 10 years ago, and some of my writing in Mending and in Facing are, came out of my own personal process. So what my passion is, what we try and do at ITAP is really try and educate therapists so that sex addicts and their families get compassionate and effective treatment. That's what we're all about. So today I'm going to go ahead and start a little bit and talk about the family system and really how sex addiction impacts the whole family system. I got it. All right. So we'll go ahead and get started. My PhD is in family therapy, so I have been trained in using a systemic lens. So that's the lens that I look through when I look at family relationships. And really, sex addiction impacts the whole system. And what we're going to start with today is just, given the fact that we have an hour, we're going to focus mostly on partners and, if we have time, children as well. But a lot of what we discuss for partners and children can also be relevant for other close relationships like parents and siblings and, extended family. So our agenda for today, we're going to talk about the traumatic impact on the partner, treating the trauma, what is facilitated disclosure, and we won't be able to go into any of the, I'm going to give you just an overview of what that is. We won't be able to go into detail on how to do that. We do a 4.5-day training, much of which is about how to do disclosure, so it's a very complex topic. And then we'll talk a little bit about the impact on children and treatment of children. So, as many of you know, sex addiction thrives in secrecy. As the addict's addiction continues, as they start to go downhill and move towards hitting bottom, they usually spin a very wicked web of lies in their lives. And this is a patient drawing of a past patient I worked with, and you can see he had been acting out with drinking, acting out sexually with both genders, and had spun a real wicked web of lies in his life. And so when that happens for the family members, it becomes, in most cases, an unfolding process of discoveries. So the most common situation, and not all cases, but in most cases, there's sort of this unfolding process where the partners start to, the addict's life starts to fall apart, and they start to pick up on the fact that there's an addiction going on. I'll give you an example. I worked with a partner, and at one point in time, she was home during the day, and the addict was a minister, and he left his cell phone on the table, and he left it and went to work. He didn't realize he didn't have it there, and she picked it up, and he had been receiving text messages with a prostitute, and that was her first discovery process. And it basically was saying, would you like to hook up? And so she responded, sure, where? And so she coordinated a meeting at a local hotel and went to the hotel where the prostitute was waiting in the car. She went up to the car, she rolled down the window, and she hit dial on the phone, so she knew it was the prostitute that he had been interacting with. And then she began to ask questions, and she got all this information about what the addict had been doing. So there's lots of different ways that these discoveries happen, but it's a complete shock to the system of the partner who thought their life was one way, and it turns out that there's all these things that they didn't know about what was going on. And so a very common thing when these discoveries start to happen is that the partner will question the addict and wonder what's going on. And the typical process of disclosure, and disclosure is when the addict shares information with the partner about the sexual acting out. And the typical process, and this is before treatment, is deny everything, disclose what you think you can get away with, disclose a bit more, get confronted as more things come out, and then disclose all, and sometimes repeat the process. So this can be devastating, obviously, for partners. We call this process staggered disclosure. And basically it's an attempt at damage control. The addicts are trying to, they're afraid they're going to hurt the partner. They're afraid of their partner's response. Those are the most common reasons for minimizing the disclosure. And so the majority of addicts, like 60% and about 70% of partners, report that there have been more than one major disclosure. And unfortunately, in most cases, families come into treatment after this has already happened. And so the trust in the relationship at this point has been destroyed because the addict is saying, no, really, I've told you everything. Now I've told you everything. And they are typically steeped in shame and, not really, because they're not in treatment, they don't understand the importance of honesty and haven't gotten into a recovery process yet. So what we have learned in recent years, and recent research has shown this, is discovery and disclosure are a traumatic event for partners. And I want to say it's not all partners that experience PTSD after disclosure, but for example, this study by Steffens and Rennie, about 70%, so it's a lot of partners, a majority, showed that partners experience PTSD symptoms and symptoms of acute stress disorder after having experienced a major discovery or disclosure. So this has really shifted the lens of how we look at partners and how we treat partners and recognizing how traumatic this is for them. And it has really, in the field, increased the sensitivity of our work in terms of understanding better what partners are going through. Omar Minwalla and I have both done research in the area of partner sexuality, which I'll talk very briefly about today, but found that that's also another area where the partners are experiencing some traumatic wounding as part of this. So we will be coming back to that. And I just want to emphasize that this is really different than infidelity. And I want to say, that infidelity can also be traumatic, so I don't want to minimize that. But often with sex addiction, there can be literally pages of information huge amounts of information and many different behaviors and extremely varied behaviors that go along with the process of sex addiction. And so oftentimes for the partner, the disclosure process includes a lot of information that they didn't know, which increases the level of trauma for the partner. And I do want to say there is a variability in responses. So while I said, as I mentioned in the Steffens and Rennie study, 70% of partners did experience symptoms of PTSD, there's also some that don't, and some partners that are very resilient. So we want to be mindful that partners all respond in their own unique ways to the experience. So this was a quote from one of my research studies. It says, "My life has been turned upside down, but because everything about sex addiction and its victims is kept a secret, I'm denied the usual support of friends and family despite the fact that my world has been shattered while my husband's life goes on like usual without any external consequences or changes for him." So oftentimes, the addict has known about this secret double life for a long time. And so when sometimes when the information comes out, there's even some experience of relief on the part of the addict, and the partners are typically blown away. And they feel like their life is shattered, and they often feel like they can't talk to anybody about it because there's so much shame around the issue of sex addiction and really so much misunderstanding in our society and, in the media, for example. So they often feel like they can't talk to anybody about it. So the amount of trauma is influenced by a lot of different factors. First of all, the amount of deception. I worked with a client once who had a calendar, and on the calendar he put everywhere he was going, and then he had a separate calendar of all the places where he told his wife he was going. So he was absolutely meticulous in covering up his tracks. And so when she had a discovery, she had no idea beforehand about anything, and there was this huge amount of deception. So that really increases the level of trauma because she was, completely blown out of the water. Secondly, also the length of time that the deception has been going on. That also is very crazy making for the partner, the longer that deception has continued. The third point I want to make is about gaslighting. So for those of you that aren't familiar with the terminology gaslighting, it is a type of covert emotional abuse that occurs in the process of the addiction. And basically, the addict, as they're spinning their web of lies, there's often a manipulation that comes along with that that's very crazy making. And the root of this word comes from an old movie in which there was psychological abuse from the husband to the wife, where he was trying to make her crazy. And so he would turn up the lights and then turn them down, and she would say, "Oh, the lights just went," and he would say, "No, they didn't." And so there was a sort of like denial of reality, and that's what we see with sex addiction. So I'm going to give you a case example to help illustrate this. I was working with an addict, and he had repeated affairs, had been in recovery for a period of time, and the partner was he had relapsed, and the partner was starting to suspect that he had relapsed. And so she was starting to question his whereabouts and his behavior. And what the addict did with that is he turned it around and he said, "You are such a grudge holder. When are you going to get over this? This is all in the past. You just can't let go of anything, and you keep on holding on to it. And when are you going to stop? You're really harming our relationship." So he kind of turned it around and put it back, put the blame on her. And that was really a manipulation on his part. And the very next morning, she found out that he was indeed having an affair again. And so that's what we talk about gaslighting. It's like the addict's deception that's really crazy making for the partner and causes them to kind of doubt their own reality. And so oftentimes an important part of treatment for partners is to get them back into their own reality and trusting their gut instinct again, and kind of reclaiming what the reality was for themselves is really important. The fourth point I want to talk about on this slide is the type of acting out, or especially if it involves offending behavior, can be very difficult. Not all disclosures are equal. And so, for example, the addict that's having an affair with the partner's sister, or the addict who's acting out with the same sex, or the addict who is into some illegal behaviors like viewing child pornography. Those types of things can increase the level of trauma for the partner. Okay, we have a question from the group, so thank you for sending in a question. It says, in the disclosure process, and we're going to talk a little bit about disclosure soon, should the addict hold certain information as to not traumatize their partner? And the answer to that, and we're going to jump forward to a slide on this in just a little bit, is that a facilitated disclosure includes all the addict's acting out behavior and all the important factual data that the partner needs to know. And it's facilitated by a therapist and a lot of support. And so now there are times when I work with my partners to be careful on the partner's part about asking for a lot of details that might be painful for the partner. A lot of times we can get information that just ends up haunting us. And so what I try and go for is very clear, factual information. For example, I had unprotected genital intercourse with 10 prostitutes between January and December of 2014. That kind of clear factual data that gives the partner all the information so that they can be empowered with the truth. So, but we will talk more about disclosure in just a little bit. So, okay, back to point number 5 here, exposure to the acting out. So if the partner has been exposed to, like I recently was working with a partner who actually walked in on the addict having sex in their bedroom. And so she was actually like faced with the whole scene that she has to struggle with in her mind now, forever. So the actual level of exposure. Another example is, a partner that comes across an addict's pornography. And oftentimes in an escalating porn addiction, there can be an incredible amount of hardcore pornography and the partner might not be used to seeing that level of content. So that kind of exposure can be very, very traumatic as well. Public embarrassment. If the addict's acting out is on news or a major event in the community, that can be very traumatic. If there's a big impact on the children or an impact on the finances, that can also be very traumatic. So this trauma triggers a lot of responses in the partner. Emotional turmoil, fear that manifests as protective behaviors, things like checking or wanting to track the addict, obsessing about the trauma, avoidance of thinking about or discussing the trauma. Some partners just want to, not think about it, avoid it. Or intrusive thinking, it keeps on popping up into their minds, they can't stop thinking about it. Sleeplessness, nightmares, I've had partners that have had headaches and physical pain and problems, health problems related as well. This is one of our partner drawings. The black here represents shame. That is, she feels so wrapped up in shame and that she can't go anywhere with it. So what the dynamic you often have here is the addict is full of shame themselves and the partner is just devastated. And so that creates this incredible rupture in the attachment bond of the couple. So this is another drawing, the addict there on his computer and the partner kind of cowering on the other side of the closed door. And anger on the part of the partner. This comic says, I'm having my wedding ring melted down into a bullet. So a lot of times partners get really, obviously, and justifiably angry given the circumstances. So one common dynamic, and again, I don't want to say that this is in all cases, but this is a common dynamic for couples, the partner confronting and demanding and the addict denying and avoiding. And that happens prior to the recovery process. And so there's increased anxiety in the coupleship, a lot of self-doubt, questioning, lack of trust, hostility. And this was a quote from a partner in one of Jennifer Schneider's studies. She said, I couldn't concentrate. I got into 2 car accidents and did things like put milk in the cupboard and cereal in the refrigerator. So oftentimes this is couples therapy not going well. This is kind of where and this is when we as therapists get the clients oftentimes in this sort of time of rupture in their relationships. I also want to talk for a few minutes on the fact that this really impacts the partners' their own sexuality. We spend so much time focusing on the addict, what's going on with the addict sexually, and what they're doing in their sexual health plan, and we give them all sorts of tests and all of this, and we don't ask what is going on with the partners. And the first person to do this was Omar Minwalla. He did a qualitative research study, which forms the basis of Chapter 6 in my book, Mending a Shattered Heart, in which he did focus groups with partners and asked them how their own sexuality had been impacted by the addict's behavior. And what he found was that they felt sexual wounding. They were it was akin to what sexual abuse victims report and rape trauma victims report, very similar types of symptomology. So I took some of his ideas in that study and I developed a qualitative instrument, a quantitative instrument called the Partner Sexuality Survey, and that journal article is coming out in the next couple of months. And these are some of the subscales on my tool, that my survey. So it's relational sexual difficulties. This is one of the most commonly endorsed scales. And so this is, partners can experience really not wanting to be sexual with the addict, and it's not anything related to sexual dysfunction. It's related more to the broken trust in the relationship. So they might find the addict repulsive, or they don't want the addict to touch them. That trust isn't there for them to feel like they can be intimate with the addict. And so this is one of the most commonly elevated. We also have sexual aversion, and this is more like, this is less commonly endorsed, but this is feeling sort of non-sexual in general. And then there's also sexual shame, sort of taking on some of like, I must not be sexy enough, or I must not be, like one of the quotes from my study was, well, I've done lots of plastic surgeries and he still looks at porn, what's wrong with me? Sort of internalizing that there's something wrong with me and my sexuality because of the addicts acting out. Body image issues, that's really common with especially with our porn addicts. I mean, no partner can really feel like they can compete with the hundred thousands of women and the novelty that is on the internet. So that can be a real issue. Risk for abuse or injury if there's dynamics, and that's again a less commonly endorsed area. Desire for retribution. Sometimes we'll have partners that, well, if he's had an affair, I'm going to have an affair as well, or some sort of desire to retaliate, and usually that's out of anger. Sexual secrets. Sometimes partners themselves have sexual secrets. And that is highly correlated when, of course, there's two sex addicts in the relationship, and the partner might have their own sexual acting out history as well. Feelings of obligation, which is, feeling like you owe it to the addict, to, the addict's in treatment, so now I feel like I owe it to him to be sexual with him or her, or he or she's in recovery, so now I have to try, but I don't really feel like I connected, those types of feelings. Broken trust, that's also one of the most commonly endorsed scales, and fear of health consequences. So there's a lot that's also going on with the partners for their sexuality as well. And so this is something that they can work on in their own individual work or in their couples work with the addict if the couple continues to move forward and they're trying to work on their committed relationship. These were just a few quotes from study participants, so you can kind of hear from, in their words, some of the impact. So one of them said, he's been in treatment for a year now and we're trying to hold it together, but I hate having sex with him now. I feel cheap and dirty. Will this ever go away? I mentioned this one already. Third one, began to internalize and took the blame for his inability to have a physical relationship with a woman. I thought there was something wrong with me. I find it difficult to trust him, even on unsex-related issues. I'm disgusted with the thought of being touched. So again, that really, the addiction impacts partners on a very personal level in the area of sexuality, and a lot of clinicians, are, missing that, I think. And it's, I think, an important area of assessment for us to kind of look at what's going on with the partner there as well. No more questions? Okay. So I think it's really important for partners to have their own treatment. So oftentimes with families, they'll think, we have a limited amount of resources. It's more important for the addict to get help. And I always really try and emphasize to the partners how important it is for them to get into their own therapeutic process and to really get into their own therapy. This is like, open heart surgery. This is like a significant trauma. And when people are going through a significant trauma, like let's say a cancer or something like that, we do a lot to support them, like have Caring Bridge websites and come support groups and come together. With sex addiction, oftentimes the partners just want to crawl into a cave and, die, basically, not talk, reach out for support. And so it's so important for them to realize this is really a traumatic event. They need help too. And so really getting them into their own therapy with their own therapist that can serve as an advocate for them in their interactions with the addict and in couples therapy process if they're also doing that. One of the methods in which I work is called the task-centered approach. And that, for those of you that are familiar with my father's work, which is Patrick Carnes, his book, Facing the Shadow, and he created the 30 task model. My book, Facing Heartbreak, for the partners, is the first 7 tasks for the partners. So they can do and each of those tasks, each 7 tasks, has many performables and exercises that the partner can do on their own healing journey so that they're doing the work that they need to do in order to heal. So I really advocate for them to get into their own individual therapy process. Also doing trauma work like EMDR and somatic experiencing and psychodrama or art therapy or whatever trauma work that you're using, that's a really important supplement to the treatment process. Also, group support. I cannot emphasize enough how helpful referring a partner into a group therapy process is. It really helps to normalize and decrease the shame, and just being with other people that have been through it is so important. 12-step support. There are 3 different fellowships for partners. There's COSA and Essanon and POSARC, which is partners. It's a newer 12-step fellowship, partners of sex addicts in recovery. So those could be additional support for the partners. Spiritual support and family and couples work when appropriate. And oftentimes, this is one area where there's also another, I think, really a change happening in the field where we used to talk about waiting until a while until each party's had a little bit of time in recovery before really doing more couples work. And these days, there's more of a focus of integrating couples work a little bit more early on. And I think that really helps because the trauma is to the relationship. And really to heal that trauma, a lot of relational work needs to be done. And so integrating couples work a little bit earlier on. And sometimes in the beginning, it's kind of like couples crisis management, especially prior to disclosure. And then you go into facilitated disclosure process and you can do more of the repair work afterwards. And there's actually more reading resources, more good books out there for partners too. So, one approach is to have the 3-legged stool where the addict has their own individual therapy and their supports groups, and a partner has their therapists and their support groups, and then a 3rd leg of the couples therapy. And of course, that's optimal, and not all couples or families will be able to do that, but some can. So this is where we're going to talk a little bit about the disclosure process. I want to emphasize that a facilitated disclosure is really only done when couples are planning on staying together. And so this is the idea behind a facilitated disclosure is this is a process in which when the addict is ready and they have really gone through, they've done their first step, they've got a lot of traction in their recovery, have really demonstrated behavioral changes and a commitment to their recovery process, and got all the information out and documented that was involved in their acting out behavior. And the partner is prepared. They're in their own therapist. They're in their own individual therapy. The therapist can facilitate the sharing of information to the partner that is in a supportive environment. And so, and this basically gives the partner any left out pieces of information that they didn't know about the addict's acting out, in hopes that that will kind of give them the foundation of honesty on which to build their new coupleship. And there won't be, more information that coming out next year or 2 years from now that the partner didn't know, and they're constantly being re-traumatized by the information. So it's an opportunity for the addict to get honest, and supports his recovery. It empowers the partner with the truth, And from a couple's perspective, it really gives you a foundation of honesty on which to build intimacy in the coupleship. So the facilitated disclosure is structured. It's very planned, and that the addict has really documented everything and has included all the information. And there's lots of different ways, and there's different methods in which to do that. It also includes the important information that the partner has questions about, and it's done in a supportive environment in which usually both the partner and the addict have a therapist present. And that's not always possible, again, but that's the most common model. And that it's really a lot of support. And so typically there's a lot of structure planned, and that's things like therapy sessions right afterwards for the partner, a plan for them for that week, care for the children, multiple sessions, so it's really done with keeping in mind the level of trauma that this can cause the partner, and so that the partner is really supported through the whole process. And then there's also, there's a path for the partner with which to process their feelings. So the addict shares the information, but then the partner comes back and they get to share what this is like for them, and to share that with the addict. And so I use, in my workbook, Facing Heartbreak, I have a partner impact letter in which the partner, it's an 8-part letter in which the partner shares with the addict how hard this has been for them. And that can be part of responding to a disclosure process on the part of the partner. Okay. So, obviously this is very traumatic, and so they really need to have their trauma validated and be able to process. Partners need to tell their story and kind of put all the pieces of the puzzle together and narrate their pain. Oftentimes after the disclosure, there's a lot of new information, so you can discuss with them the level of addiction in light of all the new information, the degree of deception, length of time. So they're kind of putting the pieces of the puzzle together. Oftentimes I'll talk to them about their boundaries. Now that we know this, what do we need to do to protect you and to support you? And so there's usually a revisiting of boundaries, trauma work for the partner, and assisting them in expressing appropriate anger. And it looks like we have another question from the group.
Would you recommend disclosure if someone's engaged and not married?
Okay. The question is, would you recommend disclosure for a couple that's engaged and not married? If this is a committed relationship that is going to be continuing on and they're going to be married, I would think yes, you would. And I think even, addicts who are dating, at some point when they get in a serious relationship, they should disclose their status as being a sex addict in recovery. And obviously it's not going to include, the partner has a right to a lot of information that happened during their relationship. So sharing information when you're dating somebody is different than when they're, I think, engaged or married. So the short answer is yes, I think so. I would emphasize that you really want a disclosure to be done with a therapist that's trained. And so, a therapist that works in this area will know whether, it's appropriate for a couple, their couple that's engaged. Okay. All right. So I'm going to talk just a little bit about the impact on children. This is a drawing from, this was a partner drawing, and she's like in the waves, and her thought bubble says, surreal, betrayal, anger, sadness, hope. And the little one says, when is Daddy coming home? And the older one says, how's Daddy? You don't sound very convincing. I know you're hiding something. So we did a study I think it was 2002. Claudia Black, Diane Dillon, and I did a study of children that had experienced disclosure and what their experiences were. And what we found was 2/3 of the time they knew before they were told. And so children are very smart and astute and pick up a lot about what's going on in the home. And oftentimes the parents don't realize that they know as much as they know. So this drawing was a 12-year-old I worked with. This is actually the partner that drew this, but I worked with the 12-year-old. The addict was viewing porn on the son's computer in his room. It says Johnny's room, no girls allowed, and there's the computer on the table. And he was actually having sex with prostitutes in the bed of the child's room. And so the child actually made the discovery, and it started unfolding from there. And he was 9 when this all happened. So obviously this can be really traumatic for the children and the family too. There's a lot of misinformation in the media about sex addiction. I mean, people like things like Castro, the guy that locked the kids and the ladies in his basement, was called a sex addict. The Craigslist killer was called a sex addict. People with, those are really, that's sociopathy, not sex addiction. But there's a lot of confusion. People don't understand, and a lot of times children will think the worst, and they'll worry that now dad's a pedophile, or he's going to be in jail. So there's a lot of misunderstanding from the perspective of a child learning that a parent is a sex addict. So it can be very traumatic for them. And if you look at the DSM definition under PTSD for children, it says any information that's developmentally inappropriate for a child can be a traumatic, like sexual information that's developmentally inappropriate can be traumatic to a child. And so certainly I think a lot of our kids, like this young man I was telling you about with the discovery at 9 and prostitutes in his room, would constitute a trauma for them. So, and sometimes I've had situations where the children feel like they have to keep it a secret, and they don't share it with the other parent, and they feel like they're harboring this secret that's really horrible and challenging for them. And it creates a lot of shame. And sometimes they carry the shame of the sex addiction in the family. And that can be very challenging. Also, caretaking and codependency and loyalty issues. I've certainly seen a lot of cases where, the children will feel like they need to protect the partner or, protect the addict in some form or fashion. So a lot of that depends, I think, on the structure of the family prior to the discovery disclosure, like the different triangles, the coalitions, the alliances in the family often start there, and then you see them kind of solidify and become more rigid after the information comes out. Also, boundary failure. Oftentimes families with sex addiction are either very rigid with boundaries, or like have no boundaries, or are very loose with boundaries. And so sometimes educating them on what healthy boundaries is important, and confusion around sexuality. For example, I worked with a young, she was like, I think like 10, 11, and her bust was beginning to develop, and she was afraid that Dad was going to be looking at her. The 9-year-old that I shared with you earlier, the 9-year-old boy, he was 12 when I worked with him, and he was very concerned. He was very, obviously natural for a 12-year-old, very interested in girls at the time, very like most 12-year-olds are. And he was afraid that he was going to be a sex addict. And so we have to educate them about what is normal and what's healthy, and that sex is a beautiful thing, and really just giving them education on healthy sexuality is really important. Looks like I have another question coming from the group. Love these questions, guys. Keep them coming. Okay, this one says, how do you get the parent to realize their sex addiction is affecting the children when the parents think nothing is wrong? Ooh, that's a challenging one. I think I would need to know a little bit more about this. Is this the child? Are you working with the child? And the child is, I need a little bit more data, I think, to be able to answer this.
Okay.
Are the parents in therapy?
Working with the parent.
She's
working with the parent.
She's working with the parent, and the parents don't think that the children are being impacted. Got it. Okay. One thing that is helpful sometimes is to get the child, if it's possible, get the child into therapy for an assessment with a good child therapist, and let the child therapist talk to them and see what the child knows, see what's going on with the child, and determine if, by obviously getting released, talking to that therapist, what's going on with the child. Sometimes that can open up the door for a little bit of work with the child, and for the parents to do some work with the child. So I don't know if I completely answered that, but I think that can be a very challenging situation. A lot of times there's a kind of a balance between wanting to protect the children. One of the things that we found in our study was out of the children that were told, that were disclosed to, they were glad that they were told, but they didn't want it to be true. So it's upsetting for, the majority were glad they were told, but the majority were upset and didn't want it to be true. And so it's kind of a challenge, because of course we want to preserve the children's innocence, and parent sexuality is not something that children usually want to have anything to do with. It's nice to have those, those boundaries. But if the children know and it's not being talked about, then that can be damaging. It's like a family secret, and then there's a lot of shame around it. So we got another question coming our way.
Have you found that the addict and spouse had similar life experiences in their family of origin?
Okay, so Pat did a research study way back when and found that there was a higher percentage of addicts that came from rigid, disengaged households, and there was also a higher percentage of partners that came from rigid, disengaged households. So there is some data that says that there is some of a similar background there. We also have high rates of, for sex addicts in particular, of sexual trauma and neglect in particular in their backgrounds. There's also emotional and physical abuse, but sexual abuse and neglect are a little bit more common. There's more research support on that. And we've also found that partners tend to have also a little bit higher rates of trauma, a sexual trauma history than the normal population. So from several studies that have come out that have looked at that. So yes, it seems like there are some commonalities, but again, each case is unique, and I'm always kind of careful not to put this, 100% are traumatized or 100% come from rigid disengaged families. That's not, this is affecting so many different types of people, and now we have sex addicts that have no trauma history that are getting online and getting, we call them rapid onset sex addicts. Most of them are porn addicts, and they're getting online, and they don't have the same etiological factors that other sex addicts do. It's just the power of the internet gets them hooked, and they don't have, they're securely attached, they don't have trauma history, and so the face of the landscape is always changing. Okay. So disclosure to children is a very delicate topic. You would really want to talk to somebody who's trained because, like I said earlier, we want to preserve and protect the children. And really, I always really ask the therapist to look at what is in the child's best interest. Sometimes there are cases when it's in the child's best interest to disclose. Like, for example, in this first situation, a forced disclosure. If it's likely that the child is going to be told in some sort of, or find out about it in some sort of non-nurturing means, it's better for the addict to sit down and take ownership and accountability with the child than for them to find out at school or for them to find out at church or for them to find out by the news media or something like that. That's sort of what we call a forced disclosure, and those can be really challenging because sometimes that can require sharing information that really is too detailed and not age appropriate with the child, unfortunately. If, dad's going to be on 9 o'clock news for some offending behavior or something like that, and you have to tell your 8-year-old, that's a really horrible situation to be in. But you'd also, other rationales were sort of validating, for disclosing to kids, of validating what they already know, or protecting them, or educating them, or sharing recovery with them if it's at an appropriate age. So there's, like, for example, you can do what's called a softened disclosure if the child knows something or, but they're still very young. So a softened disclosure does not usually involve saying dad or mom is a sex addict. It usually doesn't involve that terminology. It might be something like, let's say you have a 7-year-old who found dad's porn on the computer or something like that. You might sit down with the 7-year-old and say, daddy's been looking at pictures of people without their clothes on the computer, and that's not part of our value system, and we don't plan on doing that. This is what we are, going to do about that. So sort of really speaking in language that's developmentally appropriate for the child. Another example of a softened disclosure, I had a colleague who's had repeated affairs. She was a sex addict. She had repeated affairs. So she told her daughters when one of them had found out, and she told the other one, mommy has a boyfriend, and mommy's not supposed to have a boyfriend. Daddy's supposed to be mommy's only boyfriend. And so this is what we're doing, and you don't have to worry about us. Some sort of a reassurance to the child. And usually a softened disclosure is followed up by a delayed disclosure, which is when the child is an adult or old enough to understand and process, to then the parents can say, oh yes, I am in recovery for sex addiction. This is how it's changed my life, and I wanted to share that with you so that they understand their sort of family legacy and there's some communication about that. And you have an unbalanced, that's sort of the coined term from structural family therapy, where there's an unbalanced hierarchy in which the parent, usually it's the partner, shares information with the child or gives the child information. Oftentimes it's too much information about the sex addict. They call that an unbalanced. Or the child makes a discovery process.
Okay, we have another question. When dealing with dual addiction, such as substance abuse and sex addiction, do you deal with the sex addiction in the same way?
Oh, great question. Okay, so usually when I have somebody that is chemically dependent, I want them 30 days, I want their brain clean for 30 days before I really start to delve into the sexual issues. This treatment for sex addiction is typically very intense, and it's very hard work. And when somebody is kind of white-knuckling it in their sobriety from chemicals, it's good to get them sort of through that post-acute withdrawal period and get them sort of stabilized and then going through the process. So I think it's very important for them to have a little time to be sober. Now there are some similarities in treatment of sex addiction to chemical dependency, and there are some differences. One of the biggest differences is, the sexual health plan. Obviously, in chemicals, you abstain from mood-altering chemicals. Well, with sex, it's more like an eating disorder. You have to learn how to have a healthy relationship with sex as you have to learn how to have a healthy relationship with food. So a sex addict creates a sexual health plan that is very clearly defined. And we use what's called the three-circle method, which is a very common method where they identify behaviors that they're not going to do, and it's very individualized. And then there's boundary behaviors, danger zone behaviors, and then there's their healthy behaviors. And but yes, they often work a 12-step program that's very similar, and there are many aspects of treatment that you do for chemical dependency that are very valuable for people with sex addiction. But there are nuances to working with sex addicts and things that are very, very different than treating chemical dependency. Okay. These are some parents' descriptions of children's reactions to disclosure: shock, disbelief, fear, sadness, tearfulness, expressed anger, validation of their suspicions or knowledge. Some appear to understand, but blocked out the info and were surprised when told again later, so sort of like a repression. Attempts to comfort parents and praise for parents seeking recovery. And I have a few slides of quotes. I can't be totally honest with him anymore because I'm bound to keep his secret. I can't be totally honest about anything anymore because I'm bound to keep his secret. So a good part of my life is a big fat lie now. I felt sick, horrified. What are other people going to think? Can I be left home alone with him? I felt like I wanted to punch them, but I just sat there. I was not crazy. I had known all along. I felt twinges of guilt and a sense of needing to protect my dad. My dad was going on about his being a sex addict and treatment and steps and other stuff that I could care less about, and the word bankruptcy came up because at the time we were being sued, and that really struck a chord with me. What did that mean for me? Would I lose my bike? So you can kind of see where the kids are often coming from when looking at those quotes. And I just want to emphasize that they really need their own therapy process, and sometimes it's helpful to have them do an impact letter to the addict about how this has impacted them and how painful it's been for them, really. And I always work really carefully with children to select who in their environment they're going to share with this about, because children at schools can be so mean, and so it's really important for them to have, some select people that they can really trust, and they need people to talk to about it, but they need to be careful with, who they share information with. So trauma work, therapy can provide a safe attachment relationship to work through some of the confusion they're feeling, and just education on healthy sexuality and sex addiction. So I know we are.
Yeah, and we had one more question. Someone sent in. They wanted to know what a disclosure would look like for a 9-year-old versus, say, someone in their teens to 20. How would you do that?
Right. So again, you would want to really look at why you're disclosing to a 9-year-old. Is it in their best interest, and what the purpose is of that? You would always, whenever it's a disclosure to a child, you do not include detailed information like you do with a partner. children are fine with the generalities, like, for example, I had got in trouble using prostitution or got in trouble with porn or whatever you feel like you need to disclose. It's usually best that disclosure be from the addict with the partner present, if possible. It's important that the partner isn't in a place of taking a victim role while they're kind of working that out with the children, because then the children feel like they need to really take care of that partner. So, but again, I would caution you on doing disclosures with a 9-year-old. You want to be really careful that it's appropriate, that it's developmentally appropriate, and that it's really what you're doing is in the child's best interest. And sometimes you have to. You have to, share information that is going to be challenging for them.
Well, everybody, I want to thank you for joining us this afternoon. I know that some of you may have a few more questions, and I will unmute you and allow you to ask those to Dr. Carnes. I did want to let you know, though, that the continuing education evaluation and sign-in sheet are on the Refuge website. I've posted that link in the chat section. You go just where the same place you went to register for the webinar. If you will, fill those out and email them to me. You all should have my email address. You can also fax them to me at 352-288-0440. Again, that's 352-288-0440. And I'm going ahead and unmute you. If anyone has any questions, just let us know.
You are now unmuted.
Anybody have any questions for Dr. Carnes? No? All right. Well, thank you all for attending, and we hope that you enjoyed the webinar, and we look forward to having you join us next month.
Thank you.
Thank you.